When we review egg donation cycles, we have to focus always on three major implantation areas. The first is the quality of donor eggs. We have to be aware that even though donors are young, not all the embryos which they generate are euploid, are genetically normal. That euploidy rate is between 60 and 80% in egg donation cycles. So when we have complicated cases, we recommend to perform pre-implantation genetic screening to define genetically normal euploid embryos. The second reason why we can experience implantation failure in egg donation cycle is the receptivity window. We see that some patients, even though they implant the embryos, they have positive pregnancy tests, some of them still have their implantation window moved. Usually 70% of all the patients need 5 days progesterone to open implantation window. In patients with recurrent implantation failure, we see that implantation window is moved, that some of them need 6, 7, 8 days progesterone to be receptive. That's why in patients with recurrent implantation failure in egg donation, if the first, second transfer failed, definitely the biopsy, the uterus lining biopsy with ear map is a method of choice to define what's going on in the lining. The third problem that we can experience in egg donation cycles is immunology. It's the number of natural killer cells which could be elevated. We recommend to perform the biopsy for natural killer cells and define uterine natural killer cells in the womb, not in the blood, not circulating natural killer cells. And in selected cases, especially when we match the second or the third donor, we are focusing on HLA. We have to be aware that embryos are showing to the mom HLA-C. So in selected cases, we match donors to our patients according to their HLA.